Then there will also be a short Q&A session where you would have the opportunity to direct a question to any one of the panelists, or alternatively, you can just ask a general question and the panelists will, and myself will direct it to the panelists that we see fit. So, ladies and gents, without further ado, it gives me great pleasure to introduce our lovely panel this afternoon. First up, we have got Rob Jardine. He's a tabler from Roundtable Southern Africa, currently tabling at Sandton 121. For his profession, he is an organizational psychologist. Sorry, my apologies. Then second up, we have the guys from Wiesbaden, Roland. He is a physiotherapist, and then also David. David is by trade a lawyer. Then on behalf of RTI, we have Mr. Agrawal. He's currently serving as the Roundtable International Vice President and also a proud member of Roundtable Nepal. Then last but hopefully not the least, myself, Paul Dippenaar from Gravis 273. Roundtable Southern Africa, and currently serving as your Roundtable International Community Service Officer. So, ladies and gents, with the panel introduced, let's start with the show. Please, like I said, enjoy and partake freely. Also, please look on the chat. There is a link to menti.com. We will get to that soon, but start looking at it, start setting it up. It will form the basis of what we are trying to do as a start. So without further ado, Rob, before we get on the way, you mentioned you wanted to check in with everyone that's dialed in. So perhaps to you, Rob.
Thank you very much, Paul, and thank you everyone for joining from around the world, not only our distinguished panelists, but the ladies and gents that are joining this first of its kind and definitely not the last talk on men's mental health. So, ladies and gents, if you are dialed in, we'd love if you can interact with us today in a completely anonymous and confidential way. And I'll ask my fellow panelists as well to also dial in for the conversation. So you can either put your camera up on the screen, you can use your QR code, or you can go to menti.com and enter in the code. And as you can see, you can actually interact with each one of the slides as well. So I'm going to ask a few of our panelists to help there. This is a technique we use a lot in the virtual world. As a reminder, all your answers and everything you share is completely anonymous and confidential. They are unfiltered and uncensored. Even the swear words are found out as well. So it's kind of an open Pandora's box, should we say, opening it up for this conversation here today. So I see we've got 2 people so far that are able to give contributions, and I'm hoping we'll get a few more, either from our colleagues that are dialed in or from people that are just joining as well. I see we've got 4, and as a reminder for everyone that's just joined, please go to menti.com to have your say. We've got 4 people, and I think that's a bit of a critical it's a bit of a critical mass, so we'll move on. But as a reminder to my panelists and to everyone else who's joined, please engage with us on Mentimeter. And the first thing I'd like to do is just reframe today's conversation. And it's really around some of the understanding that, in today's society, when we are physically injured, we go to hospital, and there's, would actually be considered absurd or incredibly not thoughtful not to go to hospital. It's the right thing to do. But when we are feeling mentally ill, do we take care of ourselves in the ways that we should? And I think that's really a big part of today's conversation, is that when you break your leg, you go to a hospital. It's considered the responsible thing to do. But what do you do when your mental health has taken a turn? And speaking of our mental health, I thought I'd do a great check-in just to see how everyone's feeling here today. Again, it's completely anonymous and confidential. And I'll actually ask a few people just to vote and share how they're feeling. And while some of these answers come in, I'm actually going to ask David and Roland just coming from Germany. How are you guys doing today? If there's any doubt who's in the Southern Hemisphere and Northern Hemisphere, it's definitely you guys, because you guys are wearing shorts. I'm quite cold, but how are you guys feeling there?
So yeah, thanks for the question. Yeah, I feel great myself. So the weather is going down with the temperatures right now. So we got 21 degrees. I had a lovely walk with my dog today. So I can't feel better right now, and having a lot of great people around me. Yeah, so I'm very, very good.
Yeah, thanks everyone. Yeah, I clicked good. I'm a bit nervous, of course. We want the show to run smoothly. And also in preparation of this call, there was just some memories about some issues that came up, because it's really working with you. But overall, I'm really grateful to see you all and be able to talk to you. So I clicked good and I stand by it. Thanks.
Fantastic. And it's okay if things don't go well, because technology is never reliable, especially when we have, about 4 or 5 different continents and countries dialed in here today. So let's pray and hope thumbs in. For me, I'm actually feeling good, but my favorite team, Liverpool, is actually playing right now. So depending on the results, I could be great or not great. And thanks to those that are just joining. I see we've pumped up to about 11 people that are on the call that are dialed in. So that's really fantastic. As a reminder, please look in the chat function to engage with menti.com and the code here today. I think if we just look at some of these results, it's very clear that people are mostly feeling good or great, but not everyone is feeling that. There's one person that shared not feeling so great today, and that's perfectly fine. And that's actually part of the conversation here today. It really is okay not to feel okay. And the other part is that even if you are feeling good, not everyone may be feeling good. So you might have an awareness around that not everyone feels the same way as you, and there might be a way to check in on people today. And that's really what we're going to talk about. So the very next question I want to ask, just as another part of a check-in that's going to give us a framing for today before I hand back to our very capable host, Paulie Dippenaar, is, if I was to ask a question just around, what comes to mind when we think about men and mental health? What are some of the words, what are some of the feelings that come to mind? And while some of these come up, Giant, I'd love to ask your opinion. What comes to mind for you when we talk about men and mental health?
I think, thanks, Rob. I think the first thing is the scaredness to talk. The first thing would be the difficulty that oneself faces in coming and talking about it. So my first concern would be expressiveness of what they are feeling.
Definitely. I couldn't agree more. And it's actually coming up now on the screen. Not accepting, still a stigma, afraid, and scared to talk. And, it's not uncommon, and we'll actually unpack a bit of that with some statistics with regards to suicide when things are too late, is that, men really have this stigma around being a provider, being strong. And I see that all the time in my role as an organizational psychologist, in the same way that, a woman could express emotions in a work setting and it wouldn't be considered a weakness. But if a man expressed emotions, it's often, in a general sense, considered a weakness. And that actually is a big reason that we're having this talk today about understanding. And I see someone actually just mentioned weakness right now on the graph as well. So this is a great way just to see what's in people's heads right now, people that are joining, and thank you for those that are just joining to today's conversation. But these generally are the things: overwhelmed, loneliness. Men need to be strong. Cowboys don't cry. Pull your socks up and get on with it. Is a lot of the stigmas that exist in the men's fraternity as well. Now, we're going to go back to Menti throughout today's conversation. We're going to ask some important questions as well. But I'd love to hand back to Paulie, our host for today, to kick off the rest of the presentation.
Rob, thank you so much. I'm sure Mentimeter and what we have just done will open up a lot of more conversation. A question perhaps to you. Over the years of working as a organizational psychologist, and most recently you have worked with a very big bank in South Africa, talking to about 700 of their senior personnel, I believe. My question to you is, what is the mental state of big corporate and especially corporate companies, but especially the bigger ones. And do you see any trends over the last couple of years and problems that you see nowadays compared to perhaps 4 or 5 years ago?
That's a great question, Paulie. And there's two real points that stand out for me with regards to that question. The first thing is that in part of a corporate world, the link between well-being and performance has never been stronger. If we compare what's happened during COVID-19 and the pandemic, people know that taking care of the mental health of employees has a direct effect on performance and therefore the bottom line. So executives and senior managers are really prioritizing it because it affects their pockets. Whereas I think 5-10 years ago, if someone said, I'm having a tough time, I need to take a personal day, people would be less understanding, I think. So I think the corporate world is more fertile than it's ever been to have this kind of conversation. And second of all, there seems to be a marked psychological hangover, and I hope no one has a hangover here today. They drank too much last night, but a psychological hangover is seeming to emerge in a lot of people's mental health right now. It's that compounding effect of stress for a sustained period of time, and it's showing up in very maladaptive ways. We see a high rate of suicide. I mean, just in the last 10 days, I have known 3 young men below the age of 25 that have unfortunately taken their lives. I've also heard of another tabler that's actually been admitted into a mental health facility this very day. I found that out about an hour ago, and more of those stories are coming to light. So it's the right time to talk about it, and we're reaching a breaking point in what I've seen in this context as well with regards to mental health. Sorry, Paulie, I think you're on mute for the moment if you're talking on your end.
My apologies. Robs, thank you for that. Perhaps we will go to the next phase. Gentlemen, those of you viewers, everyone who's watching, I would like to encourage you once more to look at the QR codes, go to menti.com, type in the code. The next session that Rob will be covering will, we will have to use Menti for that. So if possible, please join in. Please let us hear your very own thoughts. So Rob, over to you again for the Menti session.
Thanks, Paulie. And I've kept the Menti up for the last 2 minutes as well, just for those that are joining. I know we had almost 10 people on the call sharing some of their thoughts. We have 2 dialed in for the moment. So let's see if we can try and pump up those numbers. And I appreciate my panelists helping out in that regard. Those who are also joining on Facebook, please look for the Menti code in the chat as well. So one thing I really want to, kind of express now is that what we're about to ask are some important questions about men's mental health, but they're also completely anonymous. We can't trace back anyone's answers to anything. So you can please be as open and as vulnerable as you'd like as well. And I'm hoping for a lot of people, when reflecting on these questions, they'll find out they're not alone. And they also might be surprised at how many people are answering yes or no to some of these important questions. So as a reminder, completely anonymous. And the first question I really would like to ask is, a lot of people kind of get curious and they look on the internet, and some people do a self-test. So I'd love to hear, have you ever done a self-test for depression or any other mental health concern? And I can already say that I'm quite surprised by the number there. Already being the majority of people have said that they have done a self-test for a mental health concern as well. And that really ties back to our first image of the day, which is, if you break a leg, you go to hospital and you get treatment. But, when we're struggling mentally, do we actually get the treatment that we need? And that's been a stereotypical challenge for men because we don't know where, we haven't been diagnosed and we don't know where to start as well. I just want to check in with my other panelists. Is out of interest, is there anything that surprises you in what's been shared of the results so far?
I think, Rob, the thing that's really surprising me is, despite of self-test being so prominent as per the data that has come, I don't see that much of people speaking it out, or maybe, you know, visiting or taking the expert help. As I see, there's a near about 50% of whoever is logged in. We can see that they have actually taken the self-test. But if you ask them as well, probably I don't see many of them actually taking the help of an expert or other mediums to get best out of it.
I see that as well. So people are definitely curious, but are people getting help once they've diagnosed themselves or once they see some warning signs as well? And I think a really interesting question that we talked about as a panelist team just yesterday is, you know, would you feel comfortable admitting to your table or to your friends or family that you've done a test as well? Because there's a lot of stigma around it as well. Like, why are you doing a test? Are you feeling okay? What's happening? And that's a big challenge that actually prevents people from seeking the help that they need. Now, for this next question, I think this really talks to what you've mentioned there, you know, Jayant, and I want to ask everyone to be honest here. Have you ever been to a mental health professional regarding your mental health state as well? We know traditionally with regards to the statistics up in men is that there is not only a higher rate of suicide that we'll talk about as well, but there's also a higher rate of underdiagnosed because people don't know what they don't know. And even despite knowing that they might have a challenge, do they actually seek help afterwards as well? And I just want to check in, you know, with our panelists. Is there anything that you find interesting or you want to comment on based on what's been shared so far?
Rob, perhaps from my side, looking at this now states exactly what we've been telling each other all along. Half of the group feels that we might have a problem. That's why we did the test in the first place, yet we have not reacted to it, and that's why we have not seen professional help. And this is why this call is so very important, to shed light on the topic and to say, well, it's okay not to be okay. And if you feel there's a problem, you should go and see someone.
Completely agree. And I think this is a big challenge that we face with regards to the pandemic as well. And I've taken a lovely screenshot of this as well, being the first session to carry on with, is that we don't know what we don't know. And there is some barriers to men seeking professional help, even when we do. So outside of that, another big topic with regards to mental health, and we're going to talk a bit more about this in a second, is that despite being a stigma of seeking help and understanding if we need help, there is a stigma around taking antidepressants or some kind of pharmacology or tablets as well that a lot of people often swear by. And I think this is a really important question to ask for a lot of people. You know, I often say that I take a level of an antidepressant myself, and I struggle to admit that. And I know I've just done it in a very open forum as well, broadcast around the world. So I don't think you get more vulnerable than that. But, you know, when one of the directors in our business said to me, you know, Rob, I'm on an antidepressant, it really shocked for me because I thought, you have it all together. You're a director and you do so well. And she's like, I do so well because I take it. I know that I need a little bit of help. And often when we go through extraordinary times, we do need a bit of extra help as well. So I can see for the majority of people, not everyone has tried antidepressants before. I'm not saying everyone should. I'm not prescribing it. Very ethically, I'm not saying that we should, but I am also saying that, you know, there is a stigma around admitting that we do in that case. And for a lot of people, we may need to, but how often do we actually have the conversation today? And that's really the framing of me calling this table. So the next question we would like to ask now is often, you know, how often do you feel down, depressed, or hopeless? Is it all the time, half the time, occasionally, or never? And maybe I'd love to bring in David and Roland's voice there based on the conversation. Is there anything that you'd like to layer in or comment on as some of these answers come in?
Yeah, thank you, Rob. Yeah, for me, it's always interesting to see, especially if you have a safe place like this with an anonymous question here, how many people actually say occasionally or half the time And we have yet to see someone saying they never feel like this. And of course, it's totally normal to not be well all the time. But of course, the numbers that are really open here are surprising in some way. But it's good to see that people are starting to understand that they're not alone in this. And the question that always is in the back of my mind, I totally support in this forum to say it's anonymous and no one should be forced to open up here. But people saying occasionally or half the time they feel depressed or hopeless, do they actually speak to their friends? Do they feel like they can open up outside of this anonymous space that we're creating here? Or do they feel, okay, this is the time that I share this, but I wouldn't with my friends and family? That's just always in the back of my mind. Do we have the forum in your table to open up on this and not just share it anonymously?
Great point as well, because as we know, there's certain things we can share with tablers, we can share with our partner or our parents, but we can't share everything with everyone. And I think that's a big part of today's conversation as well, normalizing and having that discussion. Thank you so much for sharing. What I'd like to do now is just move to the last 2 or 3 questions, but I'd also like to encourage people in the chat function on Facebook chat. Please hand in your comments and questions there as well. If you have any comments or questions, we'd love to hear from you in today's conversation. Now, this is a really interesting question. This is one of the telltale signs of depression or a mental disorder is that, are you having trouble falling asleep or sleeping too much? And I actually specialize in neuroscience in a lot of the work that I do in big corporates. And, you know, one thing I can tell you about neuroscience is that sleep is terribly important. If you are having long-term sleep problems, you can have early onset Alzheimer's, you can have a neurodegenerative disease can form later in life. So you should really pay attention to your sleep patterns. It's often a sign from your body that you need to change something and look at something. And I see more than I expected. Some people have said all of the time, I'm experiencing sleep challenges and sleeping too much or falling asleep. And I really would recommend people just to be mindful of your sleep patterns, because it's one of the questions we often ask to diagnose if people are, mentally going through a lot at the moment.
So Rob, if I may ask you in this,
yeah.
If I may ask you in this, so this is a good data that's coming in that many of them are facing sleep issues daily. So being a psychologist, what would you recommend that should be an ideal number of hours for a good sleep? I think this is something that all our viewers would be very much interested to know.
It's a great question, and there are a few schools of thought. People talk about different personality types and bodies and rhythms, but essentially you need to have a recommended about 8 hours of sleep, and quality sleep is the big thing. I actually had a bit of whiskey the other night and I fell asleep really easy. I actually fell asleep on the couch next to my partner. So it was easy to fall asleep, but I actually have one of these watches that measures my sleep, and I could tell the next day that I didn't have a restful sleep. So it's not always about 8 hours, but it's 8 hours of deep sleep, REM in different sleep states. And I would recommend people on the call to pay attention. Another interesting fact, in one of the neuroscience labs that I work with in the States, it's at UCLA near Stanford, they study stress, and that's what they do in their lab. And the complete opposite of stress and burnout is sleep on the other end of the scale. So if you want to take care of yourself and move away from stress and burnout, you have to get really good at sleeping. It's a big part of that challenge. So the next question I'd like to ask here is another typical question that we ask with regards to diagnosing depression or mental health challenges is, how often are you tired and or lack energy, or are you just not interested in the things that you normally like? And that's an important question as well. And as tablers and friends of table, with some of the ladies that might be on the call as well, is that table is a big interest and a big thing, but for some people, sometimes your interest gets not as exciting. The same things that excited you are not as exciting. You're dragging your feet to go to something. That's definitely a telltale sign that, it's worth having a conversation with someone as well. As we wait for some of these answers to come in, I just want to check, is there any comments or questions from any of the colleagues?
I think one of the important thing, Rob, that we as tablers feel is, there are many a times we do feel during our professional lives or personal lives that we are out of energy, and we are actually feeling really low in terms of how much we can give as an output. So can we just assume that these are all signs that we should be really careful of, or maybe it's just a one day off thing?
I think it's an important question. I think, where you want to be is be mindful of it. So often we're rushing and we're burnt out and we're rushing from, challenge to challenge, from to-do list to to-do list. But are we mindful of how we eat? What excites us anymore? How well are we sleeping? Because everyone is very subjective. Everyone has different bodies, different rhythms. I mean, we even joke that if you have a kid, your energy levels are very different if you don't have young children. And I think it's not necessary to say, well, if I don't get a certain amount of hours of sleep, I must go to a hospital. Or if I don't have enough energy, I must go to a hospital. We're not here today to say that. What we're here today is to say, these are the important things that we need for overall health, including mental health, because mental health is a part of our physical health. And we need to be mindful of these activities like sleep, lack of energy. And I think the last question we're going to actually ask now is about diet. So we'd love to hear from people with regards to our eating and our behavior change with regards to a poor diet or overeating. And we actually joked a bit here that, as tablers, depending on how many table events you have, you might eat and drink things that are not necessarily on the diet on the menu as well. I often joke, I actually was fortunate to be in the same table with our current president at the moment, and you can attest to one evening I was in charge of food and I tried to buy a healthy meal for everyone that night, and I got outvoted very quickly because they said, we eat healthy food at home with our wives, we come to table to escape the healthy food. I know tabling often has an interesting diet, but that's also an important thing to be mindful of. It's okay to have a pizza every now and then. I had a pizza last night, but it's about understanding that we can't let diet be a consistent challenge for us, and be mindful of that as well. So before we hand over back to Paul, I just want to check in the chat if there's anything coming through. I don't see any messages so far, but I do see some great appreciation for the talk that we're having as we continue. And what I'm going to do is I'm going to let this slide run in the background, which is the anonymous and confidential slide. It just says, what questions or comments do you have? So for those that want to engage, please feel free. We'll come back to the slide at the end. But now I'd really like to hand back to our Master of Ceremonies, Paulie, as he takes us through some fantastic activities from the rest of the tablers on our call here today.
Thank you so much, Rob, for that very, very interesting and very interactive session with Mentimeter. I'm sure we will get back to this as it left us with more questions than answers. So, but thank you so much for it. Rob, quickly back to you. I think as a medical professional, it's important for us to realize that there is actually a difference between mental health and mental illness. Do you care to clarify that for us?
It's a great question, and I most certainly do. So mental illness is often the things that make the headlines. These are things like suicide. These are things like depression, generalized anxiety disorder. These are all things that have a specific, criteria, classification, definition. They exist in different statistical manuals by doctors, and they often have codes related to medical aid and hospital admissions. So these are, are you bipolar? Are you ADHD? Do you have clinical depression? And for a lot of us, we talk about mental health, only that really comes up. Have I got a big anxiety disorder? Have I got a big problem with depression? And mental health is about the human experience. It's about the holistic health of our minds, bodies, and souls with regards to how we engage with life. It doesn't, on the extreme end, it can mean things like suicide, like generalized anxiety disorder, but mental health is about normalizing the human experience. It's okay not to feel okay. It's okay not to have bad days or good days. And it's about how we engage with life. And one thing I just want to share, I actually was at a conference 2 weeks ago, and someone who's a clinical psychologist said, you know, I became a clinical psychologist because I want to look after people. And in the discussion, they said, that's not why you become a psychologist. You become a psychologist to help people engage with life differently. And that's really what mental health is about. It's not, we're not here to say mental health is about always be positive, always be great, because life is not always positive and great. It's about how you engage with it. And that's really what mental health is.
Perfect. I don't know, any one of the other panelists would like to add something before we move on? No? Okay, Rob, guys, so as a panel, male suicide have been referred to numerous times as a silent pandemic, mainly because people don't talk about it. That's it. Now, there is some clubs, and I'm fortunate to have one of those clubs with us on call, and that's the guys from Roundtable 18, Wiesbaden. David, Roland, thank you so much for joining. Would you be so kind to share the background of your project? What are you doing? Give us and our viewers a little bit of feedback. But while you're doing that, and the next question will also tag along with it, I would like to encourage all of our viewers to interact on Facebook or offline afterwards. As Wiesbaden will tell us what they are doing, I would like to also learn what other clubs are doing, and what are you doing? What are you doing within your table, within your association, within your region, perhaps to talk about these issues and to address it. So please be interactive. Please, let's help one another. But with that, David, over to you. So back to my question. Would you be so kind to share the background of your project to our viewers?
Thank you, Paul. Very happy to do that. Thanks for giving us the opportunity in this open forum on an RTI level to talk about a project. The project started about 2 years ago when one of our tablers, who I know is watching today, was approached by two friends, or on two occasions by friends that told him that they thought about killing themselves. And as a normal person, as a non-psychologist, as a non-expert in the field, he felt, wow, what am I supposed to do with this? I want to help. I mean, it's in the DNA of every tabler that we want to help our friends and family, but he didn't fully grasp how he should do that. He was smart enough to not say, well, it will become better, hang in there, or all this typical kind of things that we might be inclined to say in the first second. But he really took the time, took a step back, talked to us at the group, as a group in table, talked to experts, and came up with, or together we came up with 5 tips that we can use to educate ourselves on mental health and how to help our friends. And those 5 tips are: talking helps, listening to, ask twice, mental health, and end the stigma. You will actually see it on my shirt here. And so we started to have this awareness campaign. We had have a presentation that we present to other tablers and other organizations in the field. And after a while, the RTI or the RT Germany board approached us and said, well, is there interest to make this a national service project for the year, so that every table in Germany can actually help get this off the ground and get the word spread around? And given we're not the first ones in Germany, of course, that have those awareness campaigns, but we really want to chip in there and see that Roundtable can be a part of this. And we're also doing it on our table itself. Every session starts with a round where we actually talk to each other, share our highlights and lowlights of the week, and really get this whole nother level started. And please follow us on Facebook or on Instagram, Roundtable 18 Wiesbaden. And please engage with us. We want to know what you do at your table or in other countries, how we can help each other take this off the ground more and inspire each other. And we're happy to share our presentation within Germany or internationally. Just approach us and you can do it in your country and at your table and help educate every tabler, because we don't want to see tabler suffering or anyone being lost along the way. Thank you, Paul.
I mean, gentlemen, this is actually so inspiring, and really thank you for the wonderful job you guys are doing. More than that, your willingness to further it out by learning from others, and also your motivation to share it to others means a lot. This is actually inspiring, and through this medium, on behalf of RTI, I would like to thank you guys as well as the whole of Table 18 for this wonderful initiative. And if I'm not wrong, this is one of the national service project of Roundtable Germany.
That is correct. Yes, as said, we've been approached by the German Roundtable Board and ran for the election to have it be a national service project. So yeah, the hundreds and thousands of tablers in Germany are now asked to actively engage with us and yeah, have everyone educated. And we are also trying to have the message sent out to the Vorderwarners Club, to the ladies circles and other organizations that might approach us. So we're really honored to have the help of everyone in Germany to further this cause.
David, thank you so much. Perhaps, Roland, a question to you. I've visited your club some time ago, post or prior to COVID, and I know you've been very heavily involved in this project. But perhaps to you on a personal level, what advice do you have for us to, on let's say on a club level, tips on how we can care for mental health on a club level? What can we do?
So maybe not an advice, but I would love to share how we do it. So maybe someone can take it. And as David said, we every club session starts with a mental health round where we open and where we are happy to share everything, either good or bad. And it's very important to say all the good things we need to share as well. So it's good to care for each other, but also to celebrate the good things in life as well. So we started that back in the Corona days, and it's a very, very important thing on the business meeting. So, and I guess we got a bit more. We stopped talking some. We changed our language a bit. So we try to not to take like words like "you're nuts" or whatever it is. So we try to be more inclusive with everyone. And on another thing, so what we do, what I did, and what some other guys from the table did is we started a thing called Mental Health First Aider, which is a first aid course for mental health. It's a 12 hours course coming up from Australia. And this is one of the big parts of our national service project to get as much mental health first aider in Roundtable Germany as we can possibly do. And it's a good way to learn how to interact with people with mental health issues. You don't see symptoms, but maybe you see signs on like depression, anxiety disorders, and even on suicidal thoughts. And this is a very, very important thing to address all these questions and to be open, be careful, and be careful with each other.
Perfect. Well, guys, on behalf of RTI, I believe I can speak for freely now. Is congratulations on what you're doing. This is truly inspiring. Keep it up, and we would support you as far as we could. Speaking of RTI, Mr. Agrawal, perhaps to you, a question. What are we as RTI doing to help and assist our members?
I think, Polly, the first thing that our aim is to create an awareness. And this program is an example of it. The awareness that you are not alone, the awareness that it's a problem with a solution, the awareness to speak up. We want the guys to talk. We want to use the platforms that are available with us where we can create this message or send this message where people or our fellow brothers and family members come out of their own spaces and speak and talk. Yes, Polly, in the month of August, this will be pushed at a very, very rapid scale in all our platforms. But taking this opportunity and with Rob and David and Roland speaking so much about it, I would like to inform them that next year it's going to be an year of mental health, where we are trying our best ways to promote and break this stigma, the stigma that Rob has been discussing about and the stereotypes that have been developed. So, and being a bottom-up approach association, just now what we heard from what Table 18 in Germany is doing, imagine just a 12-hour course for being a first aider in mental health issues or being a good listener or a good talker. So using the bottom-up approach is our ultimate aim, and we want to start this thing happening at the table level itself. It's the home for any tabler. And if you get that comfort at home, nothing better can come. But Polly, with your permission, I mean, this is something that we are doing it. But Rob, I have a general question. Okay, sorry guys, but I'm feeling it's so exciting that I have myself have so many questions right now. What would be the first thing as a friend that I or someone should do when we see someone who is close to us, who might be a friend or a colleague, and we believe he's going through or she is going through a tough time and acting strange?
Yeah, it's a very deep question, complex question, and I don't think there's any silver bullets or right answer, because there's a lot of a stigma around it, right? How do I go to Paulie and say, hey, Paulie, you're looking depressed. Do you want to talk about it? For a lot of people trying to have that conversation, it doesn't even get off the ground because of all the stigma, all the perceptions that sit around it. And part of the way to actually destigmatize it, to make it what we call in our profession psychologically safe, to have those conversations, is to role model that vulnerability yourself, to create that as well. And by doing that, we unconsciously give people the permission to do so themselves. And I give the example of, one of the mentors in my life being that director of my business who said, I actually take some pills because I struggle with depression. And as soon as she said that to me, and I'm a psychologist, right? I should know better. I'm trained in this. I should know better. But as soon as someone I respected said that, it changed that and made it feel safe for me to explore that as well. And I think that's a big part of it. Is it's hard to have that conversation to say, David, look pretty sad. Do you want to have like 6 beers and we talk about it? It's not always an easy conversation to have. But building on what they've shared as well is, to what extent do we actually have that check-in as part of our conversation? When you haven't seen your friends for a while, it's, how's your partner? How are the kids? How's the job? How's the car? How are you? Right? How are you doing? And I have that with my friends. We've recently started doing that, and we've uncovered a lot. We found out that my one friend who we thought was happily married is not. He's struggling with his marriage. But we never ask about that. We just go, oh, you have a car, you have a promotion, things are going great, we'll see you on Sunday. But having that check-in to be, how are you actually doing really? And if people are struggling to open up, it's about opening the floodgates by admitting on your side that maybe things are not going okay, and being a support for one another.
Rob, I think that's a very good approach that you have suggested, is the word, how are you? 3 simple words, but with a deep meaning in it. But sometimes, Rob, when someone is going through a tough time or someone is acting strange or might be having a difficult time period, they are offensive to our simple approaches as well. So what would be your advice is to a person who might be offensive in such situation?
It's a very difficult question or difficult answer. And we would like to give the opportunity to David and Roland to bring in their voice on this as well, because part of my strategy and things that I've seen work actually is encompassed in their 5 points. One of them is ask twice. And I would love it if, David and Roland could share their experience and could repeat those 5 points again, just for our audience, because I remember 2 or 3 of them. So if you could repeat the 5 points and then share some answers or some solutions from your context.
So so our 5 points, our 5 tips are talking helps. So try to talk to your friend and be conscious about what's happening around you. Ask twice, which means if you ask your friend, hey, are you okay? Is everything fine? And he will answer in a way which gives you the opinion, maybe there's something not so okay. Maybe ask him on another occasion. Ask him maybe later the day or on another day. Give him the opportunity to open up and be. Don't judge him. Don't talk too much. Listen. So listening helps as well. So give him the opportunity to talk about and just listen.
Yeah, the third one would be ask twice. So go back into the conversation, give them, your friends, the opportunity to really open up. And I think just taking a step off those 5 tips, we're at tip 3. What you said, Rob, be a role model. When we started talking at our table meetings, at the business meetings, everyone had the opportunity to open up, but only a few would the first session around. But it took a few weeks, and suddenly you hear stuff you never would have expected from some people. So be a role model, give it time, don't force it, but give the good example that you're there for them. So that's what we want to promote with asking helps, listening to, ask twice. And then mental health was the fourth part. It's important to make room for your own personal health and to educate everyone around you that it's helpful that they get help if they need it, and be it just from your friends. And the fifth one, end the stigma, be an active part in ending the stigma. And again, Rob, right on point, be a role model.
Yeah.
Be someone who's active in the community, active in the roundtable world, and show everyone that there's an open forum for anything and everything that's beyond your new car, the new wife, the golf clubs, whatever is fun and enjoy. There's also the second level in tabling, which really deepens and strengthens the friendships that we have if we're willing to open up and be a better community for each other.
And if you see this, it's very important to build a good foundation to your friends and to your family. So there is a good ground for asking, are you okay? Because I'm pretty sure if you're not, if you have a good foundation with someone, he wouldn't be offended if you approach him with, hey buddy, I see you struggling with something, or you behave different in the last weeks. Is everything okay with you? Do you want to talk? Do you want to have a walk outside or whatever? Just to give him the opportunity to talk. And I don't think that anyone would be offended if you have a good foundation. And this is what we try to establish in our club, in our families, and in our community.
Fantastic.
Perfect.
And,
Yeah. Yeah, Rob,
go
back
for
to
it,
you.
Paul.
No, back to you.
I was just going to say one thing, and then hopefully we can head to Menti, because there's been some interesting questions I'd like to cover. But the last thing I'll just say with David and Roland is it takes time. And I'm engaged to a dietitian, and she often says to me, no one goes from not gymming 7 days a week to gymming 5 days a week. You don't go from nothing to everything. So if we're not talking about mental health, you can't expect people to, when you ask one question, to be open up. And I think it takes time. And we found that as well, because we also, in a way, did the mental health check-in as part of our table meetings. And the first 1 or 2, it was like, yeah, I'm good, but stressed. But then after about 2 or 3 months, you got some really real conversations that emerged from it. So it's not just because you start implementing it straight away, it takes time to build up, because you don't go from doing nothing to being fully open. So I think it's about being patient. That was a great insight there. Well done, gents.
Right, Rob, thank you so much. I think we should quickly take a break from the questions, and I would like to offer you the opportunity to share some of the questions that our viewers have posted on to Menti. Thank you, Rob.
Very happy to do that. And as a reminder for those that are maybe joining a bit late or haven't heard of Menti, you can use the code there, menti.com, and you can share your completely anonymous questions. They're not confidential because we're sharing them now, but we can't see who's done what. And I think the one question I'll just highlight straight away, and this is a question I actually have, is how do we hear more about this service project from Wiesbaden? And guys, is there a link? Is there a Facebook group? Please let us know, because we want to maybe do the same or learn from you. So how do we start that journey?
So yeah, of course you can follow us on Facebook and Instagram.
Cool.
So it's Roundtable 18 Wiesbaden. But also you can find our website, which is endthestigma.de. We just set it up. It's not ready, finally ready, but we are working constantly on it. So, but you can reach out to us if you like to invite us to your business meeting, ladies or gentlemen, and we will be there. Yeah, so that's I guess the best thing to do. And of course the Tabler word, so everyone who is in there can ask everyone of our table. Everyone is in charge of this project.
I agree. Some great hints there, everyone. So actually invite, because now you know, you can invite David and Roland to your meeting and you don't have to buy them any beer at the meeting. So they just invite them on a Teams call. So it's a great opportunity as well. Just to comment on some of the other pieces here, people have said they've loved the interactive approach that we've tried. Thank you very much. I think it was part of the team of, you know, adopt, adapt, and improve. We're always trying to adopt new technologies and adapt to our context so we can improve our interaction. You know, we have covered a little bit around if you know someone who is struggling mentally, you know, what would your advice be? And we've covered a bit of that, those 5 points: role modeling, ask a few times, be patient as well. And if I look at this comment here, this person said, you know, I tried opening up about my mental health problems. People did not take me seriously. They made me feel really bad about it. How do I react to it? I think it is with a degree of compassion and care, and know that as a society and as a wider group, we don't have the skills to help people. And that's part of today's conversation. And I do see David and Roland have raised their hands. Jump in, gents.
Yeah, so I want to get on to this thing, like what advice do you have or something like that. So I really would love to take away this word of advice, because like advising someone is not always the best thing. Be supportive, be a guiding hand, be open, and so you don't have to give advices because they are not like the thing they want to hear usually. So be supportive. That's what I would love to say is the most important thing.
Yeah. And one thing to add to that, because it has been part of a TV piece in Germany and also on John Oliver 2 weeks ago in the US, and I think it's in many countries, you do admit you have a problem, you want to seek help, but it's sometimes with the health system not easy to get that help. But what we feel helps is to open up to some friends and family to help you get the professional help. So they won't be able to cure you in any ways, your friends and family, but they might be able to get you through that complicated system, getting professional help that you might need. So that's really what we also want to emphasize.
So, yeah, so maybe the struggling time to get this appointment. So if you like open up, it doesn't mean that you will find the professional help you're seeking for, and friends and family can help you to maybe overstand this time. And that's why, yeah, it's very important to open up.
Fantastic. So I think those comments are really great, really important as well. I'm just doing a time check that, ladies and gents, we are going to close the conversation in 5 minutes, but if there are any last comments or questions, please send them through. We'll address a bit of them now before I hand back to Paul in closing. And I just want to highlight this one person that shared from their association of tabling from wherever they are in the world. They've said that they've also struggled when people get silent. And I think we know those people. They generally have been quite involved. Now they kind of withdraw. They can't make table meetings. They get less involved. And I think that those are the people to watch out for. And what someone's reached out here is what they've said is reach out and be consistent. Might have to ask 1 or 2 times and just be patient in that way and don't give up. I think that's really some great advice that person has shared as well. And then one person said here, if you have a friend with anger issues, that's a really challenging piece, because to reach out to someone who's easily triggered, it's almost like walking on landmines. Trying to talk to them, one might explode. That would take a bit more of a nuanced approach. Maybe from a psychological perspective, I would encourage them to think differently. And often it's that old piece of, and I apologize for a very lame joke, everyone. I'm going to close my section with a very, very lame dad joke here. Is, you can lead a horse to water, but there has to be one to drink, right? So you can't just keep telling them and they keep exploding. But it's the old joke in psychology of how many psychologists does it take to change a light bulb? For those of you that don't know, it just takes one, but the light bulb has to want to change. So that's part of the challenge. If that person is not going to see that their anger is affecting their partner, their children, their friends, it doesn't matter how many times you ask them, they have to want to change. And also at that point, they might need a bit of psychological help with therapists outside of you as a. So with that lame joke, I do want to hand back to our MC and host, Paulie, just to close up and make any final comments before we close up.
Rob, thank you so much. Also, David, Roland, to the panel. Guys, 1 or 2 questions more to cover. So please stick around. It's really, we are creating a movement here. Now, my next question is, we all know it is a statistical fact that men struggle more with mental issues than women. Yet we do not normally seek help. Rob, perhaps once again an interactive session with you on the one side as a medical professional, and then the Wiesbaden guys with their approach to it. Why do you think that is? That men does not want to go and look for help?
I think there's a few reasons around it, and part of the challenge is the stereotypes around men to be the provider, to be big and strong, and to show emotions as weakness. And that often comes from the analogies of cowboys don't cry, pull up your socks and get on with it, and just, suck it up. And often that is a perception we as men put on ourselves, society puts on us. And that's part of the dialogue that's changing around the world in corporates and in movies and films, and also in tabling, which is part of this very first process that we're doing today. And I remember actually talking to, Giant yesterday. He says, even in my region of the world, we have the same problem. So it's not only a cultural nuance, it's men are almost required to be strong, and that's part of the challenge.
Perfect.
Yeah.
Yes.
So, Polly, if with your permission, I really want to ask one question on behalf of all the tablers. Well, guys, I mean, any one of you can take this question. We do have a life full of stress, professionally, personally. How do we find ways to relax ourselves? We have heard of many things, yoga, meditation, and everything. But in this life of gadgets and social media, where all of us are spending much more time than what is expected in such things. We are not able to find that peaceful time, I must say, that is going to help us. So, how do you guys going to help us in communicating ways that we should know the ways of limiting the uses of it and help by limiting the uses of those gadgets?
I'll mention something briefly first, and then I'll hand over to the rest of the team. Is to understand that our brains haven't developed to keep up with technology, with these rings, pings, and tings that we have on our phone. And we need to connect with the human spirit and what it means to be human. And that often means leaving our cell phone off and being fully present in the moment. And there's a big overwhelm in tablers, as an example, around burnout and taking on too much energy, too much WhatsApps, too many meetings and emails. But as a table, we can also set boundaries and maintain boundaries. This is family time. We won't talk about tabling after this period, or when we are present, we're not on our phone. So I think setting boundaries, maintaining boundaries, and prioritizing mental health is part of that solution.
Perhaps to David and Roland, do you have a closing thought on the gadget topic?
So that's my personal opinion, is that we should be careful also with our kids. So I don't have kids yet, but so there are a lot of kids around. So we need to be aware that they don't hang around with social media all the time, because especially Instagram and all this shit give them, this give them a wrong picture of the world, because there are so many people out there who are like show-offs, and they try to run around after those like role models who are don't role models. So it's very, very important to be aware that we don't that our kids consume Instagram and social media unattended, or maybe too much, and for ourselves as well, because I know I can lose myself into the reels. And so that's why it's important to set boundaries, like Greg Robb said, and try to like figure out what is like real and what is not. And on Instagram and everything, a lot of things are not real, and we should be very, very we have to see this in a clear view, I think.
Good. Ladies and gentlemen, thank you so much. We have come to a close of indeed a very wonderful session. I do have some closing thoughts. First off, to all of our viewers and listeners, very, very much thank you for viewing and for sharing your interest and thoughts. We really do appreciate. Secondly, I would like to thank my lovely panelists for all their hard work, input, and setting up this lovely show for us today, and for all your words of advice. I do think today's talk show will be the first of many more to come, and it should be. And then lastly, but not the least at all, I would like to thank our university manager, Mr. Sachin Shah, for being also taking care of the Facebook side of this talk show, as well as setting up this lovely event in the first place. With that, ladies and gentlemen, please stay safe, take care, help one another, and remember, it's okay not to be okay. Let's seek help, let's back a buddy, let's create awareness. And with that, I salute you. Take care, God bless, and have a lovely weekend. Ciao.
Thank you.